Kaylee, you're going to be graduating soon. Do you have any questions about having difficult conversations?
Well, I haven't really had the experience talking to patients on this matter. Do you have any advice?
Yeah, I think the first thing to do is to have more conversations about it with your colleagues, with other healthcare providers, and especially with your patients. Because the more that we talk about it and ask everybody else questions about it, the more that we can decrease stigma, and then everybody's just more aware. In terms of talking to your patients about that, have you learned any communication strategies that might be relevant in this situation?
I believe the best communication strategies to utilize when having these conversations with patients is to be honest, compassionate, and non-judgmental.
Another thing that I found really helpful is asking them questions every time you see them, and sometimes you have to initiate those conversations because they might feel scared or judged by bringing up the conversations themselves.
That's a great suggestion, but what do you do when the patient still insists on using cannabis throughout their pregnancy?
I know, that's a very tricky situation, really an ethical dilemma. But as a registered nurse, and as a soon-to-be registered nurse, the best thing that you can do is just support your patients where they're at. Educate them, be empathetic of their situation, and maybe work towards a goal together of trying to reduce their usage even if they're not willing to stop it altogether.